My name is Robin Fowler, and this is my contemporary theory presentation for EDCO 715. The theory I am presenting is the Unified Protocol for Transdiagnostic Treatment of Emotional Disorders. Dr. David Barlow and colleagues are the creators of the Unified Protocol for Transdiagnostic Treatment of Emotional Disorders, or UP. UP is a psychological treatment consisting of 5 core modules based on cognitive behavioral therapy. UP is designed to help patients learn how to confront and experience uncomfortable emotions and to respond in more adaptive ways. UP targets the shared core of psychological disorders. As an intervention, it targets specific psychopathological mechanisms across the disorders. The goal of UP is to target shared characteristics, particularly neuroticism and emotional dysregulation, that underline all anxiety, depressive, and related disorders. Because UP seeks to address shared mechanisms, it can be used to treat a wide range of mental health issues with a single protocol. The 5 key components of UP are mindful emotional awareness, cognitive flexibility, identifying and preventing avoidance, increasing tolerance, and engagement in emotion exercises. Mindful emotional awareness is achieved by focusing on present focus and non-judgmental awareness of emotional experiences. UP focuses on the nature of the emotions and helps clients experience greater tolerance for their emotions. Cognitive flexibility in UP focuses on not eliminating negative emotional experiences, but on assessing common negative thought patterns associated with different emotions and promoting a more flexible appraisal of those emotions. Clients learn to identify and prevent avoidance tendencies and emotion-driven behaviors. Barlow quotes Izzard from The Face of Emotion, saying, "The individual learns to act his way into a new way of feeling." UP uses interoceptive exercises to help clients face and tolerate negative emotions. Through these exercises, clients recognize the role of their physical sensation in their emotional experiences, and they identify how these sensations might influence thought and behavior. In the final stages, clients engage in exercises that incite an emotional experience in a graduated fashion. Thus, clients experience less difficult emotional exercises before moving to exercises that elicit a more intense feeling. The focus in this stage is on confronting the emotions fully, so as to identify and prevent avoidance, increase tolerance, increase cognitive flexibility, and mindful awareness. UP seeks a broader understanding of emotional disorders. UP considers that there are 3 vulnerabilities that lead to the understanding of neuroticism: a general biological vulnerability, a general psychological vulnerability, and a specific psychological vulnerability. This triple vulnerability theory in UP posits that these 3 vulnerabilities cross disorders. The first, general biological vulnerability, is based in the limbic structures and combines with a limited inhibitory control of cortical structures. The general psychological vulnerability is activated by environmental events and early life experiences. This set of experience may be disruptive or even traumatic and produce a sense of uncontrollability and unpredictability that are at the core of negative effect in the states of anxiety and depression. The third vulnerability, a specific psychological vulnerability, results from learning a particular focus for anxiety or learning that some situation, objects, or somatic events are potentially dangerous even if they are objectively not. The nature of therapy in the Unified Protocol is linked to the understanding of emotional disorders and emotional regulation. UP targets the emotional regulation or dysregulation for treatment. The goal is to help clients modify their emotional regulation habits and reduce the intensity and incidence of maladaptive experiences and improve their functioning. Treatment will involve being able to identify and understand the events that precede and may trigger emotional responses and the consequences of these responses. The UP therapist will identify these responses as the arc of emotional experiences. The A are antecedents. These are the situations that precede or trigger the emotional response or reaction in clients. In addition to events immediately preceding the emotional response, more distant events can also influence emotion and behavior. The R's are the response. This is the emotional reaction to the situation. This is the behavior or emotional reaction that is dysregulated and therefore in question. And C stands for consequences. Consequences are what clients experience after or before the emotional response. All behavior has consequences. Being able to recognize that there is an event that preceded the emotional dysregulation and understand the reaction to the event lays a foundation for being able to solve problems in the future and recognize situations which may trigger future emotional dysregulation. ARC awareness is facilitated through the therapist using the 5 core components. These core competencies are based in traditional CBT approaches and are anchored within the model of emotion, employing thoughts, feelings, and behaviors. These 5 modules of treatment are preceded by a module focused on client readiness and motivation, as well as a module on understanding emotions and emotional experience. The final module reviews the progress of the treatment and helps the client develop strategies for possible relapses. It is encouraged that clients complete all the modules, even if they feel that some modules do not apply to their particular mental health concern. There are 3 roles that I want to consider when discussing the Unified Protocol. The first is the role of assessment. Therapists are encouraged to conduct an informal assessment prior to treatment. This is to assess if clients are presenting with the characteristics that line up with emotional disorders. The UP therapist then utilizes a functional assessment in the first session. The role of this assessment is to explore the client's daily emotional experiences and how they affect their lives. Is the client experiencing emotions that interfere with their daily functioning? What are the client's physical consequences of excessive emotions? And what techniques does the client use to manage intense emotion? The second role is that of the counselor. The counselor plays the role of an educational collaborator. The client and the counselor work together to create an effective treatment plan, and the counselor should strive to gain a thorough understanding and establish a good rapport with the client. The counselor will also monitor the client's progress. They do this using the overall anxiety severity interference scale and the overall depression severity interference scale. These records can provide motivation and encouragement to clients as they review what they have achieved and learned. The third role is that of the client. The client is the expert on what is helpful or not, and this feedback allows the therapist to create the most effective treatment plan. The client will also participate actively in therapy by completing homework and practice assignments. These assignments help the client to practice the skills and concepts discussed in therapy. The client is encouraged to commit to weekly therapy, homework assignments, and practice skills. Goals of UP therapy. UP therapy seeks to help the client understand their emotional experiences. It seeks to ground the clients within the context of their experiences. The Unified Protocol seeks to help clients seek and overcome maladaptive strategies. A major distinction within UP is that the goal is not to eliminate strong or negative emotions like fear, anxiety, sadness, or anger. The ultimate goal is for clients to learn to better tolerate uncomfortable emotion and respond to these emotions and emotional triggers in more adaptive ways. UP utilizes a variety of techniques that include psychoeducation, mindfulness, identifying cognitive distortions, and interoceptive and situational exposure. In the beginning of UP therapy, the therapist will work with the client to identify and define emotions, to recognize the components of emotional experience, and to understand the functional nature of emotions. As the client gains an understanding of their emotional responses, they will understand when, where, and why these responses are occurring. Clients learn to be mindful of their emotions and to monitor the experiences surrounding their emotions. Clients are then encouraged to identify their thoughts and how they affect their emotional experience. In identifying these thoughts, clients are learning how their thoughts and interpretation of events affect their emotional response. In interoceptive exposure, clients are taught that just as thoughts influence emotions, so do physical sensation. In this regard, clients are encouraged to simulate certain physical sensations that can trigger intense emotion. The purpose of these exercises are to help clients understand the role of physical sensations, identify their internal physical sensations associated with their emotional response, and engage in exercises that increase their tolerance of the symptoms. In situational exposures, clients are asked to put themselves in situations that will likely produce an intense emotional reaction. Therapists are encouraged to practice these skills in person first. Practicing emotional exposure during a session gives the therapist the ability to give clear instructions, modeling, and to monitor the client's emotional responses during the exercises. The therapy process for the Unified Protocol is very systematic. The module that the client and the therapist work through include a motivation enhancement for treatment. In this first module, the therapist conducts the functional assessment and they work through the client's goals for therapy. The therapist will work with the client to set functional goals, which will help the client address their maladaptive emotional responses. In the second module, clients will work through the three-component model of emotions, as well as learning to recognize and track their emotional responses. In this stage, clients will learn to identify the arcs in their emotional responses, and they will also track their emotional-driven behaviors. In Module 3, clients will learn to observe their thoughts, feelings, and physical sensations that occur as a response to their emotions. Clients are taught to identify their emotions without judgment. This module will introduce mindful, present-focused exercises that allow the client to practice this observation. When clients are aware of their emotions, they can begin the process of cognitive appraisal and, when necessary, cognitive reappraisal. This process offers a way of increasing flexibility in situations by allowing the client to avoid cognitive traps in their thinking. By neutrally evaluating the situation, clients can see where their thinking has led to maladaptive appraisals, and they can increase their flexibility and cognitive awareness. The fifth module involves the clients identifying their emotional avoidance strategy and gaining a greater understanding of how these strategies contribute to their emotional dysregulation. Clients will investigate emotion-driven behaviors which are maladaptive, and they will develop alternative adaptive strategies. In Module 6, clients work to gain an awareness of their physical response and to develop a tolerance for physical sensation. In this module, and Module 7, it is suggested that the therapist perform these exercises in person. These exercises are designed to elicit an uncomfortable physical sensation. Clients are taught to recognize the physical sensation and the emotional response. As clients become more aware of this process, they can gain perspective on how their feelings influence their thoughts. In the seventh module, therapists will use the interoceptive and situation emotional exposure. This session will help clients learn new ways of responding to intense emotional situations. The goal is for the client to learn to approach the emotional exposures without avoidance and with adaptive emotion-driven behaviors. In the final module of therapy, the therapist will review the client's long-term goals, the emotional knowledge they have gained, the client's treatment progress. The therapist will help the client identify potential triggers and to set goals for continued progress. Attached are 4 examples of the UP therapy modules. The first video shows the motivational enhancement. Video 2 shows the 3-component model. Video 3 shows cognitive restructuring, and video 4 shows the module on emotional behaviors. There are 3 specific critiques of Unified Protocol therapy. The first is the limitation of the trials. There's been limited long-term follow-up to determine the efficacy of the unified protocol. The second limitation in the trials has been that much of the research on UP has been conducted in North America. And the final limitation of the trials has been that while there have been some trials that analyze the effectiveness of UP with broader disorders such as bipolar and borderline personality disorder, the majority of the research is limited to anxiety and depression. The second area of critique is in the limitation in treatment of children and adolescents. There is some concern that certain modules of UP may not be effective with children and adolescents. Children and adolescents may experience negative emotions and yet have a difficult time communicating their distress or managing their emotions. Parents may inadvertently reinforce these negative emotions. One study in particular found that children learned the skills concerning psychoeducation and emotions, and yet they struggled with the skills that dealt with experiential and mindfulness. The final area of critique has to do with limits in methodology. In particular, trials for the unified protocol need to have specific controls and specific measurable outcomes. Furthermore, it has been noted that much of the research with UP has been with clinicians that are serving or conducting research for a master's level. It is noted that UP needs to be researched with clinicians who have less formal training and education. Recently, spiritual therapies, including Christian cognitive behavioral therapy, has been found to be effective for several clinical disorders. These religious therapies are equally effective compared to standard approaches. The unified protocol can work in harmony with Christian beliefs and practices. In the area of psychoeducation, the knowledge that emotions affect our thinking is in line with Christian belief. Also, UP aligns with traditional cognitive behavioral therapy in the belief that individuals can make choices that influence and change their behaviors. This is in line with the Christian thought that we can renew our mind and that we are in control of our actions. TAN does offer caution when using mindfulness techniques. Some of these techniques are based on Eastern mysticism, and the Christian therapist should instead focus on Christian alternatives to meditation. TAN also warns that when using cognitive restructuring, it is helpful for the Christian therapist to guide their clients to consider what the Bible says about the issues instead of directing the clients to their own thoughts. For future research, further research is needed on the possibility for more methods that are more adaptive to the specific consideration of children and adolescents. There needs to be more research on the cross-cultural effectiveness of UP with diverse populations. More research is needed on the medium and long-term efficacy of UP. This needs to be research that is clinically controlled with specific controls and measured outcome, especially on the effectiveness of UP with more severe mental illness. There's been positive research in this area, but this is an area where I believe UP could benefit from clinical trials with specific guidelines and measurable outcomes. UP has also been used in the treatment of some health-related issues such as eating disorder, grief, and alcohol use. This is an area where UP should consider research for use with disorders that are primarily rooted in health concerns, such as diabetic or high blood pressure. Finally, I would suggest that there needs to be more independent research conducted by clinicians that are not associated with the Unified Protocol Institute or with Dr. Barlow. Dr. Barlow has pioneered this treatment to see and treat emotional disorders from a transdiagnostic point of view. This understanding and treatment of emotional disorders has shown great potential and has shaped this section of cognitive behavioral therapy. More independent research will only benefit the practice of the Unified Protocol and further development of the theory and practice. I've linked 4 key resources for the Unified Protocol. The first 2 are written by Dr. Barlow and his colleagues. These are the Unified Protocol for Transdiagnostic Treatment of Emotional Disorder book for therapists and the workbook. The third link is a video presentation by Dr. Barlow. And finally, there is a link to the Unified Protocol Institute.